Hello, so today I've decided to do my presentation on chapter 24. This is about the infections in the genitourinary system. So, in the genitourinary system, there are two distinct organ systems. So first you have your urinary tract. Basically what this does is it removes substances from the blood. It regulates your body processes. It forms your urine and transports out of the body. This includes your kidney, your ureter, your bladder, and your urethra. This also filters things, and the flow of urine encourages desquamation of epithelial cells in the urinary tract. So it's a very vital system in our bodies. So the most common microbial threat to the urinary system is the microbia that are usually in the normal flora of the gastrointestinal tract. So it's very important to keep up good hygiene practices. So the genital system, so its major job is reproduction. There are many different bacteria in the male and female system. So starting off about your infectious diseases in the urinary tract, you have your UTI. So this is the most common. It's usually seen in the hospital and sometimes is formed from a secondary infection. So this occurs from bacterial invasion into the urinary system. So like I said, it can be hospital associated. It can occur from a catheter. That's why when catheters are inserted, it's a sterile procedure, so that way no unfamiliar bacteria can get into the urinary system. It can get in the urinary system for many different reasons, but catheter is just one of the examples. So it's very important that when you do get a UTI, that you get it taken care of as quickly as possible, because it can be detrimental and can lead to destruction in the urinary system. So cystitis can also occur, and it can also, if it gets severe enough, it can affect the kidneys and the urethra. So it's most common in the elderly. It can lead to pain, frequent urges to urinate, burning upon voiding. In severe cases can lead to confusion, usually seen in the elderly. So the urine can be cloudy from bacteria and white blood cells. So these are some illustrations that I put on here that kind of help to understand what a UTI is. So you have your upper UTI. So this includes your kidneys and your ureters, and then you have your lower UTI infection, which includes your bladder and your urethra. So what are some symptoms of a UTI? Urinary frequency, urgency, dysuria, suprapubic tenderness, near worsening urinary incontinence, and gross hematuria. So again, misdiagnosis of UTIs can lead to serious problems, some of which are missing the true cause, promoting true UTIs, causing antimicrobial resistance, adding medication burden and drug, causing C. diff infections, and increasing adverse events. So there are more UTIs in elderly people and more in females. So next you have leptospirosis. So this is associated with wild animals and domesticated animals. It can affect the liver, kidney, brain, and the eyes. So the bacterial presence is usually in the animal tract and spread through urination from animals. So it can spread very rapidly, and it is a hazard to those who work outdoors with animals. So next, you have urinary schistosomiasis. Um, it's usually infected in two distinct mechanisms, so liver and the spleen. Um, so signs and symptoms usually are not present. So Trimadod lodges in the large blood vessels of the bladder. So there's usually itching where the helminth enters the body, and symptoms can occur at a later date. So if not treated, it can result in bladder destruction, and it also causes chronic infection. So culture is usually used to determine the disease, and it is by identifying eggs in the urine. So next, this is prostatitis. So this is inflammation of the prostate gland. It can be acute or chronic, and is always caused by a bacterial infection. So ciprofloxacin is a form of treatment or muscle relaxers called alpha blockers that relax the neck of the bladder. So it's usually sometimes unresponsive to antibiotics, which is why ciprofloxacin is used. So I thought this was pretty interesting that symptoms can be similar to prostate cancer. So it's an interesting disease. So next, this is gonorrhea. So this is a sexually transmitted disease. So usually, signs and symptoms are painful urination or yellow discharge. This can spread from the urethra to the prostate gland. So if left untreated, it can make someone become infertile. It can also enter the bloodstream in the eyes. Another thing it can do is it can infect babies in the birth canal. So if there's the infection is in the eyes, it can lead to blindness or more serious consequences. So diagnosis is usually a PCR test of secretion. No vaccine is available for this to prevent it. And this disease can lead to HIV. So it's very scary and must be treated and reported immediately. So next, this is chlamydia disease. So it's the most common reportable disease in the United States. Around 2 million cases are reported year-round. So women are more likely to experience PID. It usually occurs in adolescents or young adults. Cases are sometimes asymptomatic, and it is caused by small gram-negative bacterium. So, also another symptom is inflammation of the urethra. So it escapes certain parts of the body's immune systems. It's why it's sometimes asymptomatic. So again, PCR is used for diagnosis, and there's no vaccination to prevent this disease. So next, this is syphilis. So it's another sexually transmitted disease. It's very scary, similar to gonorrhea, but not the same. So symptoms are usually present and clinical. So they can be transferred to, again, from the baby. They can be transferred to the baby in pregnancy through the birth canal. So it's spread through direct contact with abraded skin. So you have these transfers that are present. And usually if they're open, you are more susceptible to spreading the disease. So it's transmissible in secondary and tertiary. There's a primary syphilis as well. They are more infective again if they're open. So the thing about syphilis is the bacteria cannot survive long outside of the host. So this relates to drug usage. So I just put a picture of the syphilis chancers in here. So they're very small, there's many of them, and if these chancers open up, they are more susceptible to spreading the infection. So it's very important that people keep up with the symptoms before the chancers break open or there's another onset of the disease, and inform people, inform the doctors, and get it taken care of so there's not as many cases spread throughout the world. The next disease is the Chancellor disease. So this is an ulcerative disease, and it begins as a small papule or bump. So this is caused by pleomorphic gram-negative rod. So it's sometimes painful in men, but can be unnoticed in women. It's most common in tropic and subtropics, and it's also becoming more common in the United States. So some antibiotics are effective against this disease, but not many. This can also be transferred through direct contact and sexual activity. Okay, so this is the human papillomavirus. So causative agents of genital warts. So young women have the highest rate of the human papillomavirus. There can be serious consequences if left untreated. So this infection is transmitted through direct contact. So it's caused by non-enveloped DNA viruses. And usually to diagnose this, you can use PCR-based screening tests. So it's caused by non-enveloped DNA viruses, and there is more than 100 different types of human papillomavirus, which I thought was very interesting to know. So next is Candida albicans. So this disease is a fungus that is part of the normal biota. So it grows in very thick colonies. It normally exists in the mouth and the gastrointestinal tract and so on. So damage to the bacterial biota can lead to overgrowth by the fungus. So it can be caused by broad spectrum antibiotics because they wipe out a lot of the normal flora in our bodies. So it is easily detectable on a wet prep or gram stain. So it can be spread through direct sexual contact. So all these diseases are very serious and must be treated immediately and informed by the doctors. Some of them need to be reported to discuss the incident rate. So lastly, this is Trichomonas vaginalis. So this can be asymptomatic in 50% of females. Men have seldom symptoms. So one thing that I thought was interesting is that it can cause prostate cancer. So it is part of the normal biota, so it can easily be spread through sexual and direct contact. So there's no vaccination for this disease, and it is estimated that 10 million Americans have acquired this infection in the world. But I thought it was interesting that it could cause prostate cancer, so it must be treated immediately.